Dr. Maggie, I want to get right to it. What is behind some of these symptoms associated with ADD, ADHD, autism spectrum, and sensory processing disorders?
I'm going to tell you the number one thing, just right off the bat, that I think is the holy grail in decreasing or ending these symptoms. And I'm going to already tell you it's going to be blood sugar.
Okay, wait a minute. That's sending off like a lot of mind blowing at the moment, because blood sugar is what's behind all of these symptoms?
Yes. Blood sugar.
This is a really big topic, because I know recently in the Transform Facebook group, you asked, okay, what's keeping you up at night? What's some of your biggest issues? And a lot of people said things related to the topics that we're talking about tonight. It was poor attention span, trouble with focus, concentration, feeling brain fog, kind of just feeling like they were losing their mind in some cases.
It's the inability to focus, or hyper focusing so much that you can't really focus sometimes on things that you need to for daily function. When you're looking at autism spectrum, when you're looking at sensory processing, there's definitely a different way of that sometimes you feel disconnected, or the connections that other people might be making, you're making it differently. I love to say that when you're looking at ADD, we call it attention deficit disorder. It is not an attention deficit. I have heard this said before, and I love whoever coined this. It's an attention differently disorder.
Mm-hmm.
And I feel
not a deficit, but different.
Absolutely. And so
expand upon that. How is it different?
I think and I'm going to just say that because I myself was diagnosed with ADD, actually ADHD, hyperfocused ADD, and had been on medication for, I think, 5 or 6 years. And I have a son who was diagnosed with autism spectrum when he was a very young age. So this is a topic that's near and dear to my heart. And I love the fact that in our program, this is something that we can really actually in a lot of ways easily address, but completely out of the box.
Yeah. And so many people, you see them turn around their own symptoms very quickly once they focus on proper blood sugar mastery. And so, this isn't to try to say that some of these bigger issues, maybe when you're getting spectrum diagnoses, ADD, ADHD diagnoses, or sensory processing disorder diagnoses, these are real diagnoses, right? This is not something that, we're trying to say is made up by any means, but this is something that can be addressed. The symptoms can be addressed.
Well, but here's the thing is, and I'm going to address this because traditionally we've been diagnosing kids with this, but more and more, there's also an epidemic of adults now being diagnosed with this. And somebody can say, oh, are we just raising the level of awareness? Is our diagnostic criteria better? Or, and I'm going to put this out there, is I also think that many people are erroneously, as adults, diagnosed with this. And I'm going to use myself as an example. Because if you have ADD, ADHD as a diagnosis, traditionally, most of the time it starts as a child, but yet we're diagnosing a lot of adults who didn't have symptoms with it previously, and now we have it. And I'm going to tell you that I can't wait to discuss the fact is there's a lot of underlying root causes of things that are happening to us medically that makes us look like we have these diagnoses. Because do I look like I have ADD? Do I look like I have ADHD? Do I look like any medication for it? I haven't been on any medication for it for over 10 years. And I have better focus every single year of my life than I did the previous year. So was the diagnosis actually correct? And do I even care that whether I was diagnosed with it or not? I really don't. And what I find in the program is if you have symptoms of that, let's end it. Let's deal with it. Whether you're a child, a parent of a child, or you yourself have those symptoms.
It's like Elaine says, she said, I'm in the program now, and it definitely has helped me with focus. So you do see that time and time again. As I went through the program, I saw people, from the start to the finish, you kind of see that brain fog start to lift. The focus really becomes clear and there for them.
100%. And this applies to the brain fog population, because for me, my actual biggest symptom was brain fog. And that's when I was diagnosed with ADD. And I don't have ADD, but the main symptom is brain fog. How many of you out there in the audience watching right now have brain fog that you didn't used to have before? We're going to have some special guests. I don't want to just say blood sugar and leave you hanging, because we're going to go deep dive into this.
Yeah, I'm going to go ahead and bring them both in right now. We have Ms. Jody and Ms. Bex. Thank you both so much for being with us. Jody, could you just go ahead and introduce yourselves to our audience?
Sure. Thank you for having me. My name is Jody Howe, and I am a retired elementary school principal. It was a public school of 500 students, and of those 500 students, 100 plus were preschool autism children. And I was in education for 26 years. I am currently in the Transform University program because after many, many, many months of feeling unwell and having symptoms and more symptoms and just losing quality of life and really being annoyed with the doctor merry-go-round, I decided to join the program to get to the root cause. And I have to tell you that I am a heck of a lot better than what I was 9 weeks ago.
And you're going to have a really interesting perspective too, because I know you have worked with so many children who have some of these issues that we've been talking about. Maybe they're on the spectrum, maybe they're dealing with ADD, ADHD, or sensory issues. And you have a large number of them in the schools that you worked in. And you have some interesting takes on what was being done in school versus what you saw in the Transform program, and how maybe some of the principles in the Transform program could have been extremely beneficial for these children.
Absolutely.
I cannot wait to hear more about that in a moment. First, let's say hello to Bex. Bex, thanks for being here.
Thank you so much, Anne. It's a pleasure to be here. Thank you. My name is Bex Boyer-Taylor, and I am a mother of 2 autistic children, and I myself have autism, ADHD, and sensory processing disorders diagnosed.
All 3.
All 3.
I have to say, I saw a big change in you as we went through the program. Just touch on that a little bit.
I can hardly see the person that I came into this program as the woman I see in the mirror today. When I came into this program for fibromyalgia, long and mast cell activation disorder, I had no clue that it was going to also give me my life back, make my brain function again, allow me to do things, dream. It's been amazing.
I think, you know, whether you're an adult or a parent or yourself having those symptoms, this is a very lonely journey for most people. And even Jody, I mean, you've seen people, families, they actually, your school was like one of the magnet schools pulling in a huge special needs population. But these parents are really struggling a very lonely journey with this. Mm-hmm. There's not a lot. I feel like traditionally conventional medicine really doesn't have very good answers besides in ADD, ADHD, medication, and autism. So let's go back to blood sugar. Mm-hmm. Because Jody, you and I had a conversation about this. In our program, the thing that I think is really key is people don't realize that these blood sugar swings is a big, big issue. And many people watching right now be like, I got my blood sugar licked. And we have hundreds of resources around why blood sugar is so critical in a symptom like brain fog, in sensory processing. And my question for you is, what did you experience with your own blood sugar ahas?
Personally, so I was not aware that I was having fluctuations in blood sugar, and until I, learned it through your program, and what a difference that affects. Like, that's an umbrella that affects everything. And so once you can have solid understanding here, it's connecting the art and science of managing, blood sugar. It's amazing. Even just a little tweak.
Well, and I think about like Bex, like we saw immediate symptom relief and changes in you. What was your experience with that?
Immediate. It was like literally within the first week when I was really following along with, eating regularly. My brain fog almost went away within the first week. I mean, and we're talking years long brain fog. The inability to remember my own name sometimes. And I'm not over exaggerating. Really just acute problems with that, not really understanding how things were, just really suffering. And within that first week, just making sure that I had those regular meals, making sure that I had my fat and fiber and all the things that I needed to have.
Balancing the macronutrients.
Oh yeah, the macronutrients. Right. And it just, oh, wow. I mean, it was like a light switch turned on.
It is. Here's the thing is that people don't realize our society is focused on high blood sugar, high blood sugar, high blood sugar. I'm not a diabetic and I'm fine. And the problem is people don't realize is that the problem here is that the blood sugar is swinging up and down. And the big change between high to low blood sugar, which is the area of change, I call it the delta, is really big. And that delta swing from high to low and low to high triggers the worsening of these symptoms as you go throughout the day. Yeah. And we're looking at a very sugar vulnerable population. Think about yourselves and think about all the children that you guys see. Imagine if you have ADD, autism spectrum, or sensory processing, or a combination of those. What are you going to eat most, Billy, of?
Carbs.
Carbs.
Refined carbs.
Really refined carbs.
So you take that, and as I'm processing this all, and I'm thinking back to the school, children with autism have obviously sensory issues and higher issues with food intolerances. And then they only want to eat certain textures of food. So then you have, nutritional issues. And so it's like this big spiral, but now you add in blood sugar and it's even a bigger spiral. And I think that if I would have known this when I was there, I would have loved to, make this an area of focus.
Well, that's the thing. I see parents coming through our program. I see people like Bex, adults with it as well. And this is made to educate a parent or someone themselves to be able to turn this. I mean, Bex is saying within the first week, her brain fog of years or decades was gone. I'm going to ask you, imagine if you were given just even the blood sugar mastery section of our program, right? If you had learned that 5, 10, 20 years ago, and looking at the schools, what if this was available to parents for them to have gone through, and the educators and the kitchen at the school? What do you think the impact would have been, Jody?
It would have been just huge. I mean, it sounds something like so basic. It just would have, been huge, because then, when you have high or low, when it fluctuates, and then you have gastrointestinal issues because of the food intolerances and stuff, you have higher chances of behavioral issues.
Yes.
So I think that it would just been so much more eye-opening and made more sense had I known this back then, and that we could have shared this with the families.
Yeah. And Bex, what about for you? I mean, you lived most of your life with no diagnosis, I believe. And it wasn't until your children were diagnosed that then you kind of were diagnosed yourself. Had you known this information and been able to intervene in your children's lives, and then thinking back even to your own life growing up, what would that have looked like for you?
Oh, wow. Just even the blood sugar, for my own personal experience, I used to get incredibly anxious. If I had taken a snack, there would have been no need for any anxiety medications because I was hungry. And to go back to my kids, how many times when they would have a meltdown due to, a sensory issue or something, they were just hungry.
Mm-hmm.
And because I think that the low blood sugar, what you're talking about, the cycling of it, you're incredibly vulnerable in those spaces to things. So anything that's going to come and hit you that is a sensory issue, if you weren't hungry, might not even have been a problem.
Well, think about this. In these special ed classrooms, a lot of times you have kids who can sometimes have violent outbursts. Mm-hmm. Now, think about just the emotion of irritability. The number one symptom of hypoglycemia, low blood sugar, is irritability.
Yeah.
I speak from experience as well, Bex, when you were mentioning that anxiety. My mom and I both, we have problems with blood sugar. And if we get a very low blood sugar drop, like let's say you wake up in the middle of the night or you wake up in the morning and your blood sugar has plummeted, it will actually trigger a panic attack in us, And so that's how I know that this is all connected to this, because it's happened to me. And you will have a legitimate panic attack, and it's all because of blood sugar. And as soon as I can stabilize that blood sugar, the panic goes away. So it's very real and it's very scary. And nobody, you feel like you're dying when you have a panic attack. And it all goes back to blood sugar in that case.
For any of you guys out there that are watching this, if you know somebody, please help me raise awareness. If you can tag somebody that you know in the comment section, that'd be really great. And then if you have any questions, we have additional trainings and resources that we're happy to share with you. But we can't share it with you. We don't know that that's what you need. So in the copy of this video, there's a link to chat our team if you want more information to learn more.